Minister to do the same, and all other stakeholders, including the Mission Director.
Uganda remains among the 30 high TB and HIV burden countries in the world, and one of the 20 countries that contribute to 80% of the missing TB cases globally. It is against this backdrop that the Ministry of Health implementing partners are calling for a multi-sectoral approach to effectively end TB and leprosy in the country by 2030. The Prime Minister, Robinah Nabanja, at the 5th Annual National TB and Leprosy Stakeholders Conference, said that the country has made remarkable progress in the acceleration of TB infection.
I call upon all of you to embrace a multi-sectoral approach in the fight against TB and leprosy, given that the determinants of getting the disease as well as its effects extend beyond health sector.
The fight against TB and access to essential health services must go on in spite of these emerging threats. TB, as you have heard, kills more people globally and even here in Uganda than any other infectious disease. Last year, although we achieved the global target in reducing deaths from TB, the disease claimed 12,000 Ugandans, much more than COVID-19 did.
The highlight of the conference was the launch of the Live TB Free campaign that will review the second year of implementation of the National Tuberculosis Leprosy Strategic Plan 2020-2021 and 2024-2025, whose aim is to reduce the tuberculosis incidence by 20% and leprosy cases among children from 8% to less than 3%.
Other innovations at community level that can improve the tracing of the positives. You saw the statistics that were presented here. We are still missing some people who are tested positive, but they remain unlinked to care.
The impressive fact that Uganda is one of 6 high-burden countries that has reduced their TB deaths by more than 35% since 2015.
An estimated 10.6 million people worldwide fell ill with TB, of whom 1.6 million people died. This is an increase from the 10.1 million people infected in 2020.
In 2021, 82% of the estimated 91,000 people with TB were diagnosed and started on treatment. The 18%, which is undiagnosed, continues to transmit TB in the community. Zahara Abigaba, UBC News.